very interesting to hear yesterday Dr. Major from the World Health Organization talking about his hopes for how we return to a new normal, and he thinks that could happen very soon with the help of vaccine and societal measures. We're going to hear a bit more about what the events industry thinks about that now. For this session, The Road to Recovery, a situation report on the global events sector. So I'll hand you over now to Chris Barrett, who's going to moderate this session with Rugby World Cup, AEG Europe and Birmingham 2022. Thank you.
Thanks, Ben. Hello and good morning, and welcome to The Road to Recovery, a situation report on the global events sector. My name is Christopher Barrett, and I'm editor of outdoor events industry magazine, Access to All Areas. This morning, we have two panellists involved in the planning of huge international sporting events, while John from AEG Europe will be able to provide the perspective of a leading international venue operator. This session will look at the impact of COVID-19 on the global events sector and where we go from here. During the last 5 minutes or so, I'll take questions from the audience. So if you have anything you'd like to ask panellists, please write the questions into the chat area on the right-hand side of your screens. We don't have a great deal of time, so let's get the ball rolling. Panellists, if you don't mind, I'll leave it to you to introduce yourselves. Let's start with Michelle.
Oh, good morning, everybody. I'm in New Zealand and it's nighttime, so I feel like I'm part of a live disco, as we have to get used to in this digital world. I'm the tournament director for Rugby World Cup 2021 here in New Zealand. I'm very excited to be part of this panel. Thank you.
Great, thank you. And John, please.
Good morning, everybody. My name is John Langford. I'm the Chief Operating Officer for AEG Europe. We're the European division of AEG, who owns venues such as the Staples Centre, Coachella Festival, and here in the UK, the O2 Arena.
Brilliant stuff. Okay, and Joe, please.
Yes, good morning, everybody. I'm Joe Ryan. I'm Head of Health and Safety for Birmingham 2022 Commonwealth Games. I'm leading on all matters health and safety related, occupational health and safety, looking to support the organising committee right across all phases and all venues.
Okay, great. Joe, we'll stick with you. How has the last 9 months of COVID-19 impacted your team's planning for the Commonwealth Games 2022? Has orchestrating the project with the vast majority of your staff having to work from home impacted the process? And what are you doing as the situation hopefully gets a bit better to address that?
Yeah, thanks, Chris. Good morning, everybody. It's fair to say it's been fairly challenging. It's not something that we expected to happen. I joined the organising committee back in May this year, obviously expecting to get stuck into the health and safety framework and deliver against all my milestones. But my role really has significantly changed during that time. So, you know, a lot of it, probably 80%, 70, 80% of my time's been taken up on COVID matters, really. When I first joined, and I think Ian Reid, our CEO, alluded to yesterday, at the beginning of the lockdown conditions back on the 23rd of March here in the UK, we had about 80 people sort of working for the organising committee. We're now up to 250. So it's been really challenging having people working from home. We've had, you know, and been able to try and get people back into the office where we can, and we've created a sort of safe operating sort of procedure where we can get up to about 30% back into the office at certain times during the week based on business critical activities. But the longer this goes on, I think we're now in week 38, I think it is, of the COVID restrictions. It's obviously getting harder and harder for everybody. You know, we're looking at health and well-being of our workforce to make sure everybody stays safe and healthy. But obviously working alone, you know, from a living room or a kitchen or a bedroom has become increasingly difficult. What we have done, though, we've had a highly competent and supportive team working on the COVID scenarios. In particular, our office management team and our technology team have worked very, very closely together to provide everybody with the IT equipment that they need, the equipment that they need, so that when they are working from home, they do have an environment around them that is conducive to being able to continue to deliver their work and hit their milestones. But it has to be said, it's very challenging. The elements that we've missed really is as everybody's been alluding to, is the collaboration and integration. We really do miss the opportunity where you have the ad hoc conversations in the office, and suddenly you start talking about something that you think, actually, we need to start focusing on that. We're missing out on those conversations and those opportunities. What we have done is create collaboration zones within the office. So if the teams and the functions need to get people together in a safe way, we have these areas in the building that allows them to do that without having to go into the upper floors of the office, or transmit any of the virus around the office. And we've been very fortunate up until now that we've had no cases of that such in the office. So it's been very challenging. We're obviously very optimistic and hopeful that things will change in the future, and now the vaccine's here, that we're hoping that the landscape over the next few months will start to change, and we'll be very supportive to getting people back into the office environment.
Thank you very much, Joe. Thanks. Michelle, I'd like to get a perspective from New Zealand, where the situation is extremely different with COVID-19. Obviously, as far as I'm aware, and this might not be exactly right, but I believe there's around 60 people with COVID-19 in New Zealand. None of them are actually in the community. It's an enviable situation to be in for us over here, but how has the virus impacted the planning of your event now? What are the key issues that you're having to deal with because of it?
Hi, Chris. Thank you for that. And yes, I think, firstly, I really sympathise for the position that people are in globally with COVID. It is so extreme, and we've had the taste of it here in New Zealand. However, we were lucky enough that our government said very early that they wanted to go hard and go early to make sure that we stopped COVID coming in at the border. So we had a very early lockdown and a very quick lockdown nationally, and that managed to eliminate COVID from the community. So it's a really rigorous process. It means that New Zealand borders are actually closed to anybody else other than New Zealand citizens returning home. We have had a couple of community cases pop up, but the government responds in the same way, where we lock down early and eliminate. And there's a zero tolerance factor for cases coming through the border. So as part of that, it makes for a really interesting dynamic when you look at planning a Rugby World Cup tournament. What it has meant is that the population in New Zealand at the moment gets to enjoy that sense of freedom and moving around relatively normally. We do need to wear face masks when travelling on planes, and face masks in public transport. But the day-to-day, office life and family life continues as normal, which is a true luxury right now in these times. But we never take it for granted. I think all New Zealanders take a real sense of pride in the situation we have now, and that we have to maintain that. So when you apply that to planning for the Rugby World Cup, and just like Joe, I probably spend 50% of my time focused on managed isolation and quarantine and what that will look like for Rugby World Cup 2021. I think one of the unique things, our tournament takes place from September 18th to 16th of October 2021, and it's going to be hosted in Auckland and Whangarei, and we have 3 stadiums. So it's a relatively small event footprint when you look at the other major events taking place, such as the Tokyo Olympics and the Commonwealth Games. It's a little bit more manageable. One of the unique things that New Zealand government did back in prior to the Rugby World Cup in 2011, when we hosted that here, was they introduced the Major Event Management Act, which is a really interesting piece of legislation. It gives the government some interesting powers in regard to what support they put around major events, because they recognise how important this is to our national reputation globally, and also just also to the commercial interests of these international events coming here. We really recognise ourselves as a global international event stage and destination. So what that means for us as Rugby World Cup 2021 is that we are recognised with major event status. So when we're looking at the managed isolation and quarantine requirements for the 12 teams, 11 of which will need to come in from other countries, we've got a really cooperative and collaborative relationship with the government and also World Rugby to work through those challenges. It is a very disciplined process. Anybody coming into New Zealand has to go into 14 days managed isolation and quarantine at the border. So nobody can get into the country until they've done that 14 days. So, one of the major challenges for us is just ensuring that 14 days for the teams coming in here allows them to train and prepare for the Rugby World Cup so that they can go on and be competitive and perform at their best during the tournament itself. So, I think that it's a really interesting position to be in. And I think just reiterating that number one priority for us as an event organiser for World Rugby and for the New Zealand government is public safety is number one. Keeping COVID out until we've got better control mechanisms where we can apply some other solution other than managed isolation and quarantine.
Thank you, Michelle. Great. Okay, John, and it'd be really interesting to hear your perspective of how COVID-19 has impacted AEG Europe, your venues and events. I mean, how obviously, it's been incredibly difficult to keep any buildings open. The O2 has been, actively trying to get events in there, and there are a couple planned. But can you just sort of briefly give me an overview of what's happening with your venues and events, and whether you've been able to stage many COVID-safe shows? I'm sure none of them are profitable.
Yeah, I mean, pretty much our global real estate has been shut down since March. Some regions are a little bit different to others. We're seeing a little bit of opening up in Southeast Asia, Australia, New Zealand a little bit. But certainly here, if we take the O2 as a litmus test for the sector, we were the first sector essentially to shut, and we're probably going to be the last to reopen. If we reflect on the O2, we've been through about 4 key stages. If I just think back over the last 9-10 months, the initial phase was very similar to what Joe was mentioning. It's just lockdown, dealing with lockdown, health and safety issues, looking after staff, etc. We were fortunate enough to be able to turn the O2 into an NHS training facility, supporting the Nightingale Hospital that went up at Excel. So that kicked the team into a bit of work quickly on. So lockdown and NHS was the first phase. Second phase we went into was planning on initial reopenings. So the O2's got a retail area and a bit of a leisure facility as well. So we were able to open those up in the summer. And the nice thing about that was it gave us some ways that we could test some of our safety protocols. The third kind of area that we've been working on is full-scale arena reopening. So again, similar to what Joe was saying, lots of health and safety planning, same as Michelle, thinking about what our events would look like in a COVID-safe environment. And we worked across six key areas. We looked at environmental hygiene, workforce safety, technology and equipment, food safety, the customer journey, and communications and messaging. And that was a really long process that we went through globally within all the AEG venues, as well as our sister venues, a company called ASM Global that owns over 300 venues around the world. So we worked collaboratively across the globe to kind of get some COVID-safe protocols in place. So we're now, I guess, at stage 4 where we are event ready. We'd be ready to reopen, but unfortunately there's just nothing going on at the moment with audiences anyway. We've had some ghost events, as we call them, so events without fans. Probably the most high profile of those was the season-ending ATP finals at the O2 at the end of November, which was a huge event, incredibly successful, but it really missed out without the impact of fans. In Germany, for instance, we're opening up. We've already had some basketball games, and we're going into some hockey as well. So that's kind of where we are at the moment. The only other key thing on our agenda in terms of planning is wondering what the future will look like. So, lots of scenario planning. What will our premium, what will the premium and sponsorship part of our industry look like? How will consumer confidence change? Our refund rate at the moment for rescheduled shows is only at 7.6%. So that, I guess, is a good sign in terms of consumer confidence. What will ticket demand in the economy look like? And I guess most importantly, the question we're all asking is, what's the sustainability of our existing business models and how will those need to change in future?
Okay, thank you very much. Joe, I mean, obviously, between now and your event, there's an enormous amount of uncertainty. But should vaccines or testing enable the event to take place with full capacity audiences, the fact you have participants from 73 countries could still obviously represent, huge challenges. How does that impact your planning in terms of, trying to get audiences in from around the world, but also just the complete uncertainty of quite what the event's going to look like and what the guidelines will be at the time?
Yeah, thanks, Chris. Yeah, it is obviously a challenging sort of question and a challenging situation. I mean, what we've been working on now, we've got 2 separate teams really working on the COVID scenario. I'm currently working on the here and now and what we're doing to create that safe environment for our teams to work in. Because I think what we've got to do, we need to provide a safe platform and give our workforce the environment, the best environment that we possibly can for them to do their work and continue to hit their milestones. So we've got this second group then that's starting to look at the forward planning, the COVID scenario modelling, looking at what framework we need to set up, how we monitor that, and then how we implement change and our learnings from that. And obviously we're in probably a reasonably fortunate position where we can actually benchmark and monitor other events that are being held before us, and we can learn from that. What we are doing at the moment is starting to look at additional training. So we've been working with the SGSA, the Sports Ground Safety Authority, on their SGO2 training sort of program to make sure that we look at the COVID modelling for the crowd management to bring those people in. But obviously with 71 nations, that's going to be a real challenge. We're very pleased, and I think everybody across the country and the world are over the moon at the fact that a vaccination program is starting to be rolled out. What we don't know is how long that program will take to immunise however many people. We still don't know here whether the whole of the UK population will be vaccinated. But that's going to be an interesting and a challenging point that we need to look at. Across 71 nations, what's their vaccination program going to look like? And between now and obviously 2022, how will that start to change the landscape and the environment that we're working within? Clearly, we're not currently at full productivity with our workforce at the moment, and we don't probably anticipate to really get back to full productivity with everybody back in the office until early to late spring, really. I think one important point that we probably do need to understand as well, and what I've been looking at is, as we have all of these COVID restrictions in place, the vaccination program really starts to get underway. At what point do all these restrictions start to get eased? And my view is that because it's a virus that is spread through social interaction, that the social distancing element of that will probably be one of the last controls to be relaxed, which means that we need to start looking at probably an as-is plan at the moment for the games, but also we need to be considering an alternative plan, which would be a social distance model, and obviously that has a lot of implications. Along the way, over the next 18 to 20 months, we obviously need to create and are working on a decision-making roadmap at what point we need to make key decisions. So that's going to be really important. And again, those timelines may change because it depends on the external factors, what's happening around the globe. But the variables that we need to monitor and continually monitor, there's quite a number, but we've categorised them really into 4 areas. Is really public health. So every week we monitor case numbers within our region, within the West Midlands and across the UK. We're obviously looking at the vaccination programme and how that's being rolled out, the test and trace programme, and also rapid testing, which is starting to be sort of implemented more and more across the UK. But also we're monitoring what's happening with the NHS capability and what the impact of the whole situation is having on the NHS. We're looking at government policy and the health and safety executives policy, because obviously what the government are telling us directly impacts on what we need to do. So we need to be proactive in monitoring what they're saying and then react to those changes. But ideally, we want to be ahead of the game and understand what those changes might mean and then adapt our model. But that will also include, as soon as the government starts to change policy, it will then influence people movement around the country and around the world. So that's going to be an important factor. John has pointed out already, I think, the element of public confidence. And again, that is really something that is hugely important and is outside of our control. It's really that public appetite now, as the vaccination program, is implemented over the next sort of 2 to 3 months. Is that going to change public confidence and encourage people to come back out again and start to attend events as they're allowed to do? We need to understand what that public appetite is going to be to get back out there again. But also coupled with that then is the political mood. It's all about what's happening around the world and how all the governments are viewing this whole pandemic. On top of that, our last point then is the economical side. As a Games, we want to support the regional recovery in the West Midlands and encourage people back to work and so on, and encourage consumer spending. So you couple all of those together, health policy, economics, and public confidence. We need to then obviously monitor those and have a programme within our modelling to monitor those and obviously implement change where we need to and be very reactive to that. So in short, the answer to the question is we don't know what the next 18, 20 months are going to look like, but we need to be in a position where we can react very quickly to that change. And hopefully, we all hope, touch wood, that we are on a pathway to getting back to normal. We always hear the words, the new norm. My personal view on that and professional view is that I believe we're all in a position to inform and influence that new normal. So rather than wait for a new normal to come along, we can shape in the events world what that new normal is going to look like. And that just presents some opportunities, that we can think about. There's opportunities with broadcast. Can we enhance the customer experience through broadcast? Can we open up opportunities with technology innovation and digital platforms and engagement, new medical insights? All of our events can learn from each other, but ultimately would lead
I have to pass on to somebody else now because we're literally running out of time. We could just wrap up quickly. Sorry. Okay. Sorry.
It's a blend, isn't it? It's a blend of physical and virtual presence. What we're looking at using technology.
Thank you. Sorry to cut you a little bit short. We just have got very limited time. Thank you very much. Really interesting perspective. Michelle, obviously, you're able to get athletes there, which is wonderful, with 14-day quarantine and everything else. But the fact that, it's difficult to kind of get fans of any, to get international fans there, that's obviously, has a revenue impact. Do you feel that in New Zealand at the moment, the events industry and supply chain are being sufficiently supported?
Yeah, it's an interesting one. I think the model for Rugby World Cup 2021 didn't have a massive focus on international fans, mostly travelling family members. And one of the really interesting things we've seen out of the Super Rugby Aotearoa competition, which happened earlier this year, was just that huge patriotism for live events, and I think the luxury of being able to have live events. So we would have full packed stadiums, which we hadn't had for a long time watching Super Rugby. All the New Zealanders coming out to support live events because they recognised what a privilege it was to be able to go, to the fact that you have the fans there and waving the flags and things. So I think that it's a really interesting situation where we see it as an amazing opportunity to supercharge the women's game, which has always been the promise that we made to World Rugby about hosting Rugby World Cup 2021 here in New Zealand, is that we wanted to take the game and supercharge it. We want to put the aroha, which means love in Maori, into rugby and into the women's game and really showcase women on the world stage. And so that's absolutely what our intention is. And COVID, in a way, made that proposition stronger. There's more eyeballs on the game. There's more people looking for live sport. They want to watch, these high performance athletes excelling. And, we've got this amazing chance to do that for women's rugby. I think New Zealand's always prided itself on leading the suffrage movement globally and being the first place in the world to give women the vote. We want to continue that with, putting women's sport on the world stage where it needs to be and packing out the stadiums to go along with that. So I think that in terms of the supply chain in New Zealand, the main thing for us really is that event owners need to operate at new heightened risk levels. But there's this incredible value in keeping going. We need it. It means the cost of delivery, the variables of COVID, all of that is a much bigger cost, but at the same time, the opportunity is also greater for having the eyeballs on the game and things. That, for us, it's governments just really need to step up to support local organising committees with the heightened risk profile and do what's necessary to keep events and continuing. The people need to be able to look forward to events and feel proud of something and, that light at the end of the tunnel. Events and sport give people hope. So we have to trudge on. We have to see the new, event, the new normal, and we have to keep pushing forward because actually people need it. We know that, how desperate times have been and how depressing it is. But when you can see live sport happening, it gives you hope that it's going to improve and the situation's going to get better. So, I hope that with our stage here in New Zealand, that we can continue that. And, we've got a trifecta of major international women's World Cups. We've got the Women's Cricket World Cup in 2022. We've got the FIFA Women's World Cup in 2023 and obviously Rugby World Cup 2021 next year. So we've got a trifecta of major international women's sports events happening here in our country. We are just going to champion pushing those through and showing the world what we can deliver down here. And, we just hope by the time we get through that the world's in a much better place, especially by the time those other two events take place, so we can get some international visitors here to support and cheer on.
Brilliant stuff. Okay, just quickly, John, we're running out of time, but the industry in many countries anyway, is calling on government for an opening timeline and underwritten cancellation insurance. Just to be able to get major events off the ground next year. Do you feel that any progress is being made in that way?
Yes, there is progress being made, but I think the challenge we found is that there is only so much that we can do as an industry. So there's a bucket of what we can control, then there's a bucket of what we can influence, and then there is a bucket of things completely beyond our control. And, there's been a lot of conversation, obviously, in the last week about mass testing, vaccines, etc. We can't control that, but we need to be plugged into that. So the key thing for me is that dialogue with government is critical. And as an events industry, it took us some time to get on the table, around the table with government to be having those conversations. But I'm confident that those conversations are happening right around the world. And then just quickly to touch on the reinsurance is without a government-backed insurance scheme, we don't believe that we can reopen effectively. There is still so much risk about the COVID pandemic. Events being rescheduled again or cancelled again, and the commercial insurance industry won't cover those things. So we're really calling on governments to support a reinsurance program. Yesterday, one was announced in Germany, and so we just reiterate our call for that in the UK and other sectors around the world.
Okay, and are you getting much positive feedback from DCMS and UK government regarding the insurance so far? Is that looking like it's making progress?
It is making progress. We've got buy-in from DCMS. The challenge is we need to get around the table with Treasury, and there's lots of demands on Treasury at the moment. So we've been working closely with DCMS on putting some case studies together, evidence of not being able to get commercial insurance. So that's sitting at Treasury at the moment, and the lobbying efforts continue.
Okay, and we're running out of time, but there's time for one question from the audience. I mean, obviously, with COVID-19 and everything else you're having to handle, how do you manage to balance that with just your existing jobs, essentially? I'll just put that to you, John.
I feel like I'm working harder than I've ever worked before, and it's just so frustrating that we're planning, and there is just nothing happening in terms of revenue or events, and that can be incredibly frustrating. Joe mentioned it as well, that our other challenge is just motivating staff and plugging into staff. There aren't those water cooler moments anymore. Everything is just so focused, down a camera, and that makes things really, really difficult. So I just cannot wait to actually get back to what it is that we love to do.
Absolutely. Okay, well, thank you very much, guys. Really interesting conversation. Really interested to hear all of your perspectives. I'm sorry we couldn't go into some of those subjects a little bit in a little bit more detail, but really interesting perspectives from all of you. That brings us to the end of the session. And I hope to be able to speak to you all in the future. Best of luck with your events.
Thanks, Chris.
Thanks, Chris.
Cheers.
Thank you very much indeed. Okay.
Thanks very much, Chris. And thanks to all of the panelists there, Michelle Hooper from Rugby World Cup New Zealand 2021, John Langford from AG Europe, Joe Ryan, Head of Health and Safety at Birmingham 2022 Commonwealth Games. I'm sorry you didn't all get longer to speak there about a huge and critical topic that you're all grappling with right now, as are all of our delegates, myself included, about how to work our way through this global situation.